Now we are going to discuss this part, third part in our lecture. I am Dr. Noha Slim. I am an assistant professor at the Community Medicine Department. So in this part of the lecture, we will discuss, or we will continue discussing the cycle of infection of TB. Regarding the reservoir, in human type of TB, the reservoir of infection are cases of pulmonary tuberculosis with positive sputum. That's to say, smear positive pulmonary TB. Because in a smear positive case, the sputum contains large number of tubercle bacilli, which can be easily transmitted from one person to another. So this is the reservoir in human type. While in bovine TB, the reservoir is infected cattle. The source of infection is respiratory secretions of a case of pulmonary TB who excrete large number of tubercle bacilli. On the other hand, in the bovine TB, the source of infection is the unpasteurized milk of TB infected cattle. It is the source of infection in bovine tuberculosis. Regarding the portal of exit, for the human type, the portal of exit is the respiratory tract where organisms leave the body via the nose and the mouth. On the other hand, for the bovine TB, the exit is the udder of TB infected cattle, where organisms are liberated with the milk. The portal of inlet in the human TB is the nose and the mouth. This is the portal of inlet of the microorganism into the body. While in bovine TB, the organism enters through the mouth after ingestion of unpasteurized milk or dairy products from TB-infected cattle. The mode of transmission of TB. Regarding pulmonary TB, it is transmitted by contact transmission. That's to say, droplet transmission. Droplets are sprayed out onto the mucous membrane of the nose and the mouth. When coughing or sneezing, this is called droplet transmission. Those droplets are usually of large size, larger than 5 micron. And to a lesser extent, can be pulmonary TB can be transmitted less commonly by indirect contact with contaminated articles. Another mode of transmission is airborne transmission, where there are tiny particles, very, very small in size, less than 5 microns. They comes out from the mouth while talking, for example. Because of their very, very small size, they remain suspended in air for long time, and they can travel for longer distance. This is the airborne transmission, and this figure differentiates the droplet transmission and the airborne transmission. It depends on the particle size. In case of bovine TB, the mode of transmission is common vehicle. The vehicle of transmission is unpasteurized milk and dairy products coming out from TB infected cattle, and that's why it is a zoonotic disease, as we mentioned this in the previous slides. Regarding susceptibility to TB infection is general, but of course higher among persons who have personal characteristics that make them more prone to get the infection and to develop the disease. For example, if the person is at old age, or if the person has one of the chronic diseases, for example, chronic renal failure or uncontrolled diabetes mellitus, or after attack of measles, for example, in children, or receiving immune suppressive therapy, or in HIV patients, if he is a healthcare worker, so the susceptibility will be higher. The immunity is cell-mediated, depends on cellular proliferation. Immunity against TB is either natural active or artificial active. Now, natural active immunity, it comes after or following infection, while artificial active, it comes after receiving the BCG vaccination. There is no natural passive immunity for TB. Yani newborns do not acquire passive natural immunity from their mothers, because it is a cell-mediated immunity, cannot be transferred from the mother to the fetus, and that's why BCG vaccination in developing countries like Egypt is compulsory, and usually our infants in Egypt have to receive the BCG vaccine immediately after birth, because they do not acquire passive natural immunity from the mother, and that's why we have to give them the first the BCG vaccination as early as possible, immediately after birth. The incubation period from infection until the appearance of the primary lesion is 4 to 12 weeks, while the period between the infection to the development of progressive disease, whether pulmonary or extrapulmonary tuberculosis, is from 6 to 12 months or maybe longer. There is variation in the incubation period. Regarding the period of communicability, tuberculosis is a disease of moderate communicability in which the secondary attack rate is 48%. Patients are infective as long as they are left untreated, because when they are untreated, their sputum will contain large number of tubercle bacilli that can be easily transmitted from one person to another. So they are infective as long as they remain untreated. Effective treatment reduces the infectivity by 90% within 48 hours. And that's why receiving antimicrobial chemotherapy for TB is very important to reduce the transmissibility or the communicability of the disease. Now, period of communicability varies from one person to another, and this because actually period of communicability depends on several factors. It depends on characteristics related to the case, characteristics related to the contact, and characteristics related to the environment, which might lead to the fact that disease might be more communicable in certain circumstances and less communicable in other circumstances. For example, characteristics of the case that affect the period of communicability are the clinical type of the disease, the frequency of cough, and the amount of the sputum produced, and the level of personal hygiene of the person, of the patient himself. Characteristics related to the contact include his immunity status and his resistance, his age, his medical condition, his closeness with the case. I mean, how many times he has been exposed to this patient. And characteristics related to the environment. For example, the crowding index, the housing condition, to what extent there is proper ventilation, whether natural or artificial, direct sunlight exposure, to what extent the measures of disinfection are properly implemented in the environment. All these factors affect the period of communicability of the disease.